This conference will now be recorded.
Before we start about anything, I would like you to know that I don't know if you know me or not. I am Muhammad. I'm from Egypt, originally from Egypt. I've been living in UK for 13 years, since 2008, and I'm an orthopedic doctor in Liverpool University Hospital, and I'm an OSCE examiner for final year medical school students, again in Liverpool University Hospital. Okay, guys, before we speak about PLAB 2, I would like you to know that PLAB 2 and PLAB 1 are both different exams. Okay, PLAB 1 exam is all about knowledge. PLAB 1 is all about knowledge, how much you know. Okay, PLAB 2, if you open the GMC website, again, I said mute the mic. Can you mute the mic, guys, if you don't mind? PLAB 2 is all about number one is all about how you communicate with the patient, how you communicate with the patient, how you talk to the patient, how you actually speak to the patient in terms of how you tell the patient the management, how you take history from the patient. It's how you talk and how you deal and being a safe doctor. So I would like to say in PLAB 2, you are all junior doctors. You are all FY2 doctors. So PLAB 2 is 16 station. By that I mean 16 OSCEs. So 16 rooms, and you will open the room and you will have just you and the patient. Just you and the patient. Okay. So what do I mean by just me and the patient? Number one. Number two, what do I mean by I am an FY2 doctor in PLAB 2? So many doctors don't pass PLAB 2 from the first time. Sometimes they do it twice and 3 times and they don't pass it. And these doctors, they are very knowledgeable. They have plenty of knowledge. Some others, they pass PLAB 2 from the first time and they are all new doctors, junior, internship doctor. So PLAB 2, to pass PLAB 2, okay, it's not related really to how much knowledge and how much experience you have. Why? Because in PLAB 2, in every single cubicle, in every single station, you are an FY2 doctor. Can you please, guys, write down on the chat box? Can you please write down on the chat box? So in PLAB 2, who you are? Can you please answer me in the chat box, because I always like interaction. In PLAB 2 exam, who you are? Who you are? You are an FY2 doctor. What is the meaning? What is the meaning of an FY2 doctor? Okay, in UK, FY2 is internship, because in UK, medicine is 5 years and 2 years foundation, total 7. In Egypt, 6 years and 1 year foundation, 1 year internship. So in PLAB 2, you are an FY2 doctor. So can you please write down the first word, who you are, please? Who you are. That's the first question. Who you are, guys? Today is an induction about PLAB 2. And today, I will basically, after you finish today's session, you can go and you can read anything, and you can find plenty of mistakes when you study, when you read any notes, because not because people give the wrong mistakes, give the wrong details or the wrong info. No. It's because of people don't really know the key for PLAB 2. In PLAB 2, you are an FY2 doctor. Who you are? You are an FY2 doctor. Okay. In PLAB 2 exam, whom you are talking to? The second question, whom you are talking to? Okay, whom you are talking to, guys? Whom you are talking to in PLAB 2? Please, whom you are talking to? Whom you are talking to in PLAB 2? You are talking to a patient. You are not talking to an examiner. You are not talking to a doctor. You are talking to a patient. So this is the second question today. whom you are talking to. So who you are, write down in brackets, you are a Mickey Mouse doctor. Mickey Mouse doctor? Mickey Mouse? Yeah, Mickey Mouse doctor. What do you mean by Mickey Mouse doctor? What do you mean by Mickey Mouse doctor? To pass PLAB 2 is easy if you know how, okay? What do I mean by you are a Mickey Mouse doctor? The meaning of Mickey Mouse doctor, I mean that can you do surgery as an internship doctor? Can you do surgery? Can you do surgery? Can you do surgery? No. Can you order MRI? Do you have the authority as an internship doctor to order MRI? No. Do you have the authority as an FY2 doctor to even order CT scan? No. Do you have the authority as an FY2 doctor, okay, to do, like, for example, nailing in a patient who's having a fracture, to operate on a patient with a fracture? No. For example, if you have a patient with a fracture, a patient with fracture femur, what is your job? What is your job? Your job is to order an X-ray to confirm the fracture and to stabilize the fracture. Not fix, stabilize the fracture, not fix the fracture. Okay, so I am a Mickey Mouse doctor. Yes, you are the T-boy. The T-boy? Yes, the T-boy. T-boy. The T-boy of the hospital, which means in Arabic, Mizo, and I don't know in Indian or Pakistani, what do you call the internship doctor? I don't know why you call the internship doctor back home in India or Pakistan, or, you know. Basically, you are the one, your job is to make sure the patient is stable. Stable means the patient is symptomatic free. If the patient needs oxygen, he is on oxygen. If the patient needs fluid, he is on fluid. I'm going to give you another example. If a mother is bringing her, all this is to explain the meaning of Mickey Mouse doctor. So who you are? Who you are in PLAB 2? Who you are in PLAB 2? The answer is Mickey Mouse doctor. Okay, Mickey Mouse doctor means if you have a mother who is bringing her child and the child is 6 weeks old, the male boy, and he's vomiting, and you are suspecting pyloric stenosis. What is your job in this case? What is your job in this case? What is your job? Your job in this case is to give him fluids, IV fluids, and basically speak to the surgeon, pediatric surgeon, because the child will need surgery. Do you understand what I'm saying? Your job is to perform or to order ultrasound, ABG, blood test, and that's it. Okay. If you have a patient with MI, A&E, and you have a patient with MI, all this is to explain who you are. Dr. Mo, what do you mean by that? Guys, if you, in PLAB 2, if you go beyond your job, if you go beyond your task, if you do something that you shouldn't have done, if you say, I will perform surgery, and you talk about surgery, perfect. You're gonna fail the station. Why would you fail the station if you know more? Why would you fail the station if you talk about details of surgery? Why? And you will perform surgery and you know how to perform it and you spoke about it perfect. Why would you fail the station? Because you are not a safe doctor. You are not a safe doctor. You are not a safe doctor. So if you don't know your rule, if you go beyond your job description, if you go beyond your rule, that means that you are not a safe doctor. That means that you're not going to pass the station. We don't want someone who will do something beyond his job description. We don't want someone who's not safe. So that's the first question, who you are. So if you have a patient and you are suspecting MI can you please write on the chat box, if you have a patient and you are suspecting MI, what will you do as an FY2 doctor? What is your job here? ECG, cardiac enzymes. Perfect, perfect. Mona, that's it. Dr. Ibrahim, well done. Dr. Ibrahim, well done. Dr. Ibrahim said Mona, morphine, oxygen, nitrogen, aspirin. Okay, would you do anything? Would you do any procedure? Would you do any procedure to these patients? No. Okay. Now, how long have we, since we started the meeting? Since we started the meeting now, how long? How long? Since we have started the meeting. How long, guys? Since we have started the meeting? 15 minutes. After these 15 minutes, you can go and you can even spot plenty of mistakes. What do you mean plenty of mistakes? You can be doing a station, a scenario with a doctor who maybe failed the PLAB 2 twice, and you say to him or to her, let's come and do station pyloric stenosis. All right. And I want you to watch them and the way they are talking to you about management. You know, they will do everything for you. We will take that child to surgery and they will have an operation. Would you like me to tell you the name of the operation? Would you like me to tell you how will we do it? We're going to make a hole. We're going to go. We're going to take a piece. That's not my business. That is not my business. My business is we're going to make sure that Adam is stable. We're going to give him fluids through his veins. Okay? We're going to check the, we're going to do some blood tests. We're going to check the blood gases. We're going to do this. We're going to do that. And that's it. Then we're going to refer him because he may need surgery. You don't need to talk about the details of surgery to the patient. And again, with MI, heart attack, all what you need to do is admit, talk to senior, run some investigations, ECG and blood, and Mona. And then further, I'm going to refer to cardiologists who may consider such and such, but you don't talk about it in details. So this is the first question in brief, who you are in PLAB 2. Okay. What is the second question? What is the second question? What is my second question? At the start, I gave you two questions. We answered the first one, who you are. What is the second question? Whom you are talking to. Okay. Whom you are talking to. Whom you are talking to, guys. Whom you are talking to. Whom you are talking to. Write down in brackets. Write down in brackets, you are talking to a child. Write down the word child, please. Child. Child. Write down. Child. What do you mean, child? What do I mean by I am a Mickey Mouse doctor and I am talking to a child? Okay. Dr. Ibrahim, the one who said Mona. Dr. Ibrahim, are you online?
Yes, doctor.
Yes, Dr. Ibrahim, how are you? You okay?
I'm fine so far.
Where are you from?
Syria.
Syria. All right. Dr. Ibrahim, I am the patient, and when you talk history, you suspected MI. You suspected MI, and I'm the patient, and you will tell me, the diagnosis. How would you say it? Okay. So now, guys, we are trying to answer the second question, whom you are talking to. How would you say it to me? How would you explain it to me? I'm the patient.
I will try to use simple words.
Yes. No, tell me. Tell me now.
Yeah.
Tell me.
Regarding MI?
Now, tell me, I'm the patient, and you're suspecting MI. I'm your patient now, and yeah.
So, Mr. Sam, I suspect you have a serious condition. It's related to your heart, and it's a heart injury. Because if it's serious, we need to refer you to a heart doctor.
That's it. So now, guys, when he said we will refer you, then he started management. So now I assume that he finished his diagnosis. Okay. Another doctor can open the mic and tell me, I am the patient. How would you tell me that I have heart attack. Dr. Ibrahim, thank you very much. He said you have a serious condition, injury in your heart, and then he started management. Started talking about management. Anybody?
Hi.
Yes, doctor.
Hi. Yes, doctor.
Yeah, you can tell me.
Okay. Mr.
Yes.
Yes.
Okay. 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 I will tell you guys. I will tell you because the doctor is lost. Anybody else wants to say it? Anybody else?
Can I?
Yes, yes, doctor. Carry on. Yes.
Unfortunately, you have a condition
Well,
when blood supply to the heart suddenly stops.
Okay. All right, doctor. Okay. Okay. Listen to me, guys. When I said whom you are talking to, what did I say? Whom we talking to? What did I say? Can you write on the chat box? Whom we are talking to?
Patient.
Whom? No, I did not say a patient. I did not say a patient. I said child. Child. Child means, I will tell you now, child means, because guys, wallahi, this is the way to pass PLAB 2. It's not about how much you know, it's how you communicate. Mr. Andrew. Yes, doctor. From the information that you have given me, and after examining you, I am suspecting a condition of your heart. So Mr. Andrew's brain will go to the heart. He will start thinking of his heart, where the blood supply that is going to your heart is decreased, and sometimes it stops. That leads to a part of the heart muscle not able to work and pump the blood to the body. So I want to speak to the patient like a child. A condition of your heart, it is decrease in the blood supply that is going to the heart muscle. Decrease or stoppage. So either it's decreased or stopped. So that's how I want you to speak to the patient in a very simple, very smooth, very as if you're talking to a child. I don't want to hear heart injury. I don't want to hear, no. I want you to actually a bit of details about the condition, but it's in a very simple language. For example, if the patient is diagnosed appendicitis, how would you say it? Can anybody tell me? Now we are answering the question of whom you are talking to. If a patient is diagnosed with appendicitis, you are telling him or her, how would you say it? Anybody wants to talk?
Can I?
May I try, doctor?
Yes, doctor. Yes, doctor.
So I would tell the patient, okay, for example, the patient, his name is Dr. Mo. Okay, Mo, right? So I would say, Mr. Mo, you the pain that you have in your tummy is brought by a part of your tummy that has gotten infected.
Okay.
And it might lead to sorry, can you hear me?
Yes, I can.
I don't know. Huh?
So, Mr. Mo, the pain you have in your tummy is caused by part of your tummy that has gotten infected, and it might lead to serious complication. So we might need to treat you by surgery.
That's it. Now we started talking about treatment. Okay. So anybody else wants to tell me? Now he said it's a condition of the tummy inflamed.
Can I try?
Anybody else? Yes, you can try, doctor. Here you go. Start. Yes.
Well, Mr. Mo, as you have described your pain, and after the examination, I'm suspecting that you have a condition in your appendix. Do you know what appendix is?
No, doctor.
Well, it's a part of our gut, and sometime it might happen that it become inflamed. So in that case, you have this inflamed appendix. That's why you are having this pain. Do you want to know how
Okay, it's a
we're
part
gonna
of our
treat
gut,
it?
yeah?
Yeah.
Okay, all right, doctor. And it's inflamed, yeah?
Yes.
All right. Okay, guys, can I tell you how would I say appendicitis to a patient?
Oh, yes.
Can you switch off your mic, please, guys? Mr. Andrew, from the information that you have given me and after examining you, I am suspecting a condition in your gut or in your tummy. All right. In our tummy, there is a finger-like structure. There is a finger-like structure. This finger-like structure, we call it appendix. Usually, or sometimes, this appendix gets infected with some bacteria, and it leads to the pain that you are having now. So, appendix is a finger-like structure. This finger-like structure, where in our gut, in our tummy. You don't need to say small bowel and large bowel, and you don't. Okay? And it is infected with some bacteria, and that leads to the pain that you are having now. So a bit of details when you speak to the patient as if you are talking to a child. This is the answer for the second question. Okay, what is the third question? The third question is where you are. Where you are. Where you are. Where you are. Where you are in PLAB 2 is very important. And again, you will never understand the answer for this question unless you start working in UK. Unless you start working in UK and then you know the system. If you are in the system in UK, it's a quite difficult, complicated system. Okay? Okay. And can you please, if you don't mind, can you please write every single word that will come out of my mouth now? Write it down, especially in this question, where you are. Why do I need to tell you now, especially in this question? Write down every single word that will come out of my mouth, because you will find disaster. When I mean disaster, I mean disaster. Disaster. When you start reading notes and papers, you will find disaster in this point. Okay? And if any of you has a relative, a colleague, a friend who is working in UK as a GP or as a surgeon, as a, whatever, you can talk to them and you can tell them which way is the right way, that or that. Because what I'm going to say now, it is basically one of the things that many doctors get low marks in management because they don't know what is happening in the system. And because whichever you read from, it is basically full of mistakes when it comes to where you are. Okay. Write down 5 settings. Write down number 1, GP clinic. Write down GP clinic, number 1. Write down number 2, A&E. A&E. Write down number 3, psychiatry department. Psychiatry department. Psychiatry department. Number 4, cardiology department. Number 5, gum clinic. QM. Can you switch? Guys, can you mute the mic, please? The mic, please. Okay. So, what is GP clinic? What is a GP clinic? Okay. A GP clinic is a place where if you come to a GP clinic, number one, you need to ring in advance. Ring in advance? What do you mean ring in advance? What do I mean by ring in advance? I need to ring. Hi, I am Muhammad and I would like to book an appointment with the GP. Okay. What do you have? I have abdominal pain. I have whatever. I have some headache, whatever. Okay, you can come in 2 days. You can come in 3 days. Okay, all right. What time? Such and such. So what does that mean by you ring to book an appointment? What does that mean? You ring to book an appointment. It means, would you see an MI in GP clinic? No, I wouldn't. Why? Because an MI patient would ring, hi, can I book an appointment, please? Because I have severe central crushing chest pain. No, doesn't happen. All the time you'll see this in A&E. Okay. Can you see an emergency case in GP? No, you can't. Number one. Okay. What else about GP clinic? In GP clinic, you don't do X-ray, you don't do CT scan, you don't do MRI. The only thing that they do in GP clinic, that they take blood from you. They take blood from you. All right. They take blood from me. And what else? And they send it to the lab that's not in the building, that's not in the GP. They send it to a lab. And then it comes the result to the GP, and the GP tells you come in 10 days or come in 2 weeks for review of your blood. So what do you mean, Dr. Mo, by a GP clinic is they take the blood, and the blood will be sent to a lab, and then you come 2 weeks later for a review of your blood. It means that in the GP clinic, if they bring the question in the exam, in a GP clinic, you cannot say to a patient who's coming to you in a GP clinic that I will take blood and you expect the blood result to come in 2-3 hours. No. That's why the questions that come in PLAB 2 in a GP clinic setting, it's always follow-up stations. It's always a station where the patient is coming for a follow-up with his blood result. A patient was coming for a follow-up with whatever blood test is done, and now he's coming for a follow-up, and the result is in the clinic, is in the cubicle, and then discuss the result with him and manage the patient. That's always the GP setting. It's always a follow-up. Okay. So the mistakes that always people make when you say, I have a patient in a GP clinic and the patient rang the GP and the patient is having a suspicion, for example, of he's coming to you, and when you take history in the GP, you are suspecting a cancer. You are suspecting a cancer in a GP clinic. What investigation will you do?
Just the routine one, I think.
Yes, these are the mistakes that all the scripts and all the notes and everybody, okay, do. And then they fail the exam, and then they say PLAB 2 is difficult. Guys, it's not difficult. You just need to know the way. It's not difficult. Guys, if I have a patient who's coming to me in a GP clinic and I'm taking history, for example, I'm suspecting that this patient is having a melanoma. Do you think I will say to him, I will take blood from you, and 2 weeks later, come, we'll review the blood? What will you do with the blood? Because the blood result will come out anyway after 2 weeks. So I don't mean will come out, I mean it will come out, will go to the lab will send you the result, and you need to see the patient in 2 weeks. No. This patient will be urgently referred, and there they will do everything. Then you can talk about the investigation that will be done after the referral. Will refer you urgent referral, where they will do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Why? Because in a GP clinic, if I take the blood, I will send it to the lab, and then the patient needs to come for a follow-up later on for his blood. Guys, did you understand this little trick? It's something, again, will deduct marks from you in management. Why? Because you don't know the system, you don't know what you are talking about, and they need people who are not smart, who are not, people who knows what's going on, people who understand the system well, people who knows what to talk about. So in a GP setting, what is the scenario in a GP setting? In a GP setting, doctor, I feel tired, doctor. Anything else, yeah, brother? I feel heart racing, doctor. My heart is racing. Anything else? Lethargic, doctor, and lightheadedness. Okay. I will take some blood from you. I'm suspecting iron deficiency anemia, and we'll take some blood, and you can come for a follow-up later in 10 days, but we'll start you on iron. Then 10 days or 2 weeks later, they come, and the doctor will review the blood with them, and they already on iron, and they will put the management plan. Did you understand the difference between this one and the one before? Did you understand the difference between this one and the one before?
Yeah, definitely.
Guys, these things are fine touch. Things that it doesn't matter how much you have been preparing for PLAB 2. It's fine. You may even know about these things. You may even not heard about these things. That's why I said to you, passing a PLAB 2 is not tough, it's not difficult, but you need to know what's happening. You need to understand what's going on. Then you can talk to people who are preparing for PLAB 2 for a while, and then you realize that they don't know anything about anything, and then it's not about how much you've been preparing for. Okay, so if a patient is coming to you, and guys, the GP setting, did you understand it? Did you understand the GP setting? That's why in the exam, the GP setting will be always cold cases or acute cases. Number two, in a GP setting, what is the maximum investigation you do? Maximum investigation you do. Maximum blood, maximum blood test, maximum blood test. And if you order X-ray, even the X-ray, again, the patient will go somewhere, they will do the X-ray, then they will come to you 2 weeks later for the X-ray. If you are suspecting, if you have a patient and the patient is having a sprain somewhere, and you are trying to exclude fracture, you do the X-ray. But if you are sure it's a fracture, guys, I will repeat the question again. I will repeat the question. I want to move to the second point. This is my problem. I cannot move to another point unless you are 100% sure about the first point. If I am a patient coming with you in a GP clinic, I had a fall 3-4 days ago, and I'm in pain, severe pain. I rang. I said I had a fall and I'm in pain and this and that. I'm in severe pain. And then they said, okay, 2 days later, come to the GP. I went to the GP clinic, and the GP is suspecting a fracture. He's suspecting fracture. What will he do? Write down in the chat box. What will he do if he is suspecting a fracture?
Refer to the ones who deal with bone. I forgot the name of those people, right?
Perfect. He's not gonna order an X-ray. He's not gonna order an X-ray. Why wouldn't he order an X-ray? Because he will order the X-ray. The patient will go to the X-ray 4 or 5 days later, because it's like no kind of urgent X-ray. Then 2 weeks later, the patient will come to discuss the X-ray result. Guys, you understand what I'm saying or not? Do you understand what I'm saying or not?
Yes, sir.
However, if he is suspecting a sprain and he wants to exclude fracture, then it's fine. It's a sprain, but we'll just refer you for a scan and, just to make sure. If he's suspecting a sprain and he knows that it's not a fracture and he just want to make sure, and, just as a routine to make sure to have an evidence it's not a fracture, that's different. That's, yes, you can send him home, it's fine, and then, you can go to, if he's suspecting a sprain and for a medical legal, he wants just to make sure that he's excluded. But if it is a fracture and he's thinking it's a fracture, he will send the patient to the hospital. And there, they will do an X-ray, which will take 5 minutes. And they will then he will do an X-ray, which will take 5 minutes. Okay. Now come to the guys. Do you understand the difference?
Yes, sir.
Okay. You need to understand this, because you're not gonna hear this anywhere. You heard it now, and that's it. You're not gonna hear it again. Then you can modify the notes when you study, when you prepare. You just modify things according to what you understood. The second point is an A&E doctor. If you are an A&E, the second setting where you are, we're still in where you are. GP discussed. The second is A&E. Okay. If you are in the A&E and you have the same case, a patient come to you, you are an A&E doctor and you are suspecting a fracture, what will you do?
Then we might go for an X-ray and then just send him to the relevant department if we see an X-ray.
That's
An
it.
X-ray.
That's it. Because the X-ray is in the hospital, CT is in the A&E department, X-ray is within the A&E. You will order the X-ray, and then what will you do if it's a fracture?
Start
Refer him
treatment.
to
The senior.
No, give me one word.
Discuss with ortho.
Or
One
discuss with
word.
ortho.
Stabilize. No.
Refer.
No, you're not gonna refer. No, you're not gonna refer first. You're gonna do your job first. Your job is to stabilize the fracture, then refer. So, what's your job? What's your job? Leave the senior now, guys. The senior and these things, okay, it's there. I mean, today I'm trying to explain principle, not actually the management steps. Yes, back slap, stabilize, then refer. So stabilize, then refer, not refer. You need to stabilize the fracture. Guys, clear?
Yeah.
This year is coming. This year is coming out with. This year is coming out with suspicion. Yeah, you know, like in the A&E, you have everything. You have X-ray, you have CT, you have the blood, the lab, everything around you. So in the A&E, you will do the X-ray if it's a fracture. Before you refer, you need to make sure the fracture is stabilized. Then refer. Clear?
Do painkillers come in the stabilization process?
100%, 100%. Of course, guys. I am not here to discuss management. Guys, today it is an induction. I'm not here to discuss the management steps, 7 steps, what to do, then what to do. I am here to give you broad lines of differences of things. You understand?
Yes.
Obviously, I'm not here to give you the management steps and tell you step 1, step 2, step 3, 7 steps, admit, then senior. I'm here to give you a feel of looking at PLAB 2 from outside. We are not inside yet. Do you understand me? We are looking from outside. Where, who, where you are, who you are, whom you're talking to, you know? Okay. The third scenario. So now we finish GP, now A&E, now the third scenario. Or I can give you another scenario in the A&E. If you are having a patient in the A&E and you are suspecting MR, what would you do to the patient? How would you manage the patient? Tell me. You are the FY2 doctor.
ECG troponin.
ECG, cardiac enzymes. Then
Stabilize.
Then Mona. Then Mona.
Mona. Yeah.
Then after Mona.
Senior.
After Mona, you will refer. That's it. Refer to cardiologist who will do whatever, but anything, who will do whatever he will do. But your job is admit, senior, the investigations, the ECG, Mona, and then refer. So you don't do anything beyond the Mona. You don't do anything beyond Mona. Okay. Another scenario. Another scenario in the A&E. Another scenario in the A&E. If you have a patient who tried to kill herself, and in the history, by the way, all these are PLAB 2 scenarios. I am not discussing anything. I am not discussing anything what to do in INGP. One of the doctors can answer Dr. Roxamna. Can anybody answer her? She's saying, but what if the MI is in the GP clinic? What to do? You can answer her, guys. No. You don't have MI in GP clinic. You don't have MI in GP clinic, guys. In GP clinic, you don't have MI. Clear?
Yeah.
It cannot happen. Why? Because I told you why early on. Anyway, so the third scenario or the fourth scenario, if you are having a patient who took 15 tablets of paracetamol, 20 tablets, make it 20, 22. She tried to kill herself. And you are an FY2 doctor in D&E. She's depressed, suicidal, okay? Depressed, suicidal, and she tried to kill herself and she took 22 tablets. القهوة حلوة يا دكتور محمد. Nice coffee, huh? بندق. She took 22 tablets of paracetamol. And you are an FY2 doctor in the A&E. So what is your job in this case? What is your job in this case? She tried to kill herself. She had low mood. So first of all, what is your history in this case? Can you write down?
When did she take it? When did she take it?
No, in the chat box. In the chat box. What is your history? What is your history? Okay. By the way, I will ask you, I will make it easier. Do you need to take psychiatric history or not? Do you need to take psychiatric? That's what I wanted to hear. That's what I wanted to hear. Dr. Rizwan Ahmed, before, during, after. Dr. Rizwan Ahmed, before, during, after. That's what I wanted to hear. Wrong answer. I wanted to hear the wrong because I like to hear the wrong answers. I like to hear and see wrong answers in order to make sure that, you know, you will get the right thing. Okay? Guys, in this case, what did you take? How many? Anything else
22.
you've taken apart from this pill? Since when? With water or with alcohol? You will take an emergency. Well, this girl is your job in the A&E with a girl who took 22 tablets of anything. Is your job to take psychiatric history? Is your job to take psychiatric history or make sure she's stable fast? You need to make sure she is stable fast. So your history will be medical or psychiatry?
Medical.
Medical history. That's why when you go again and you read the scripts that doesn't make any sense, people take and people write down psychiatric history and medical history, and they want to manage and they want to talk about the mood and this in 8 minutes. Then they fill the station and they say we couldn't finish on time. Why didn't you finish on time? Why didn't you finish on time? Why? Because you cannot have 8 minutes. Every station is 8 minutes. Every station in PLAB 2 is 8 minutes. You cannot have 8 minutes, and in these 8 minutes, you talk about suicide and you talk about mood and low mood and depression. When she's about to die, she has taken overdose from whatever. So you need to make her stable medically. Would you like me to give you remember in PLAB 1, the example of anorexia nervosa? Anorexia nervosa, you remember? If the BMI is 15, 14, 15, medical. If the BMI is 16, psychiatry. You remember this example?
Yeah.
Exactly. So in PLAB 2, again, it's very important. However, if the question said to you, example number 3, we have finished GP now, we have finished D&E. What is the second example? What is the third place? I told you there is 5 places. What is the third place?
Psychiatry department.
But if the same question said you are an FY2 in the psychiatry department, what is your job here? Your job?
Take history.
Let's sit down. Can you please tell me what happened? How is your mood? Okay, why did you do that? Were you who was there? Did anybody witness it? Before you take this, did you tell anyone? Before you take this, did you write any suicidal notes? After this, how do you see your future? How do you see your life? Would you do this again? Psychiatric history. So what is the difference between the two questions that I've just given, that one and the one before? What is the difference? What is the difference? The difference is the place. Is the place. The difference is the place. The difference is the place.
Any and another is psychiatric.
That's it.
Place is different.
That's it. That's it. That's it. The difference is the place. Is the place. The difference is nothing but place is different. The location is different. And that's what happened in PLAB 2. And people fail the station because of the location. They just like mix things up and they don't know how to filter the stuff and it just like mixed up. So please, I will recap what I've mentioned. I will recap what I've mentioned, and you just answer me in the chat box. The first question, who you are. The first question, who you are. Can you answer me? No, I'm not an FY2. No, I'm not an FY2. No. I'm a Mickey Mouse doctor. I'm a Mickey Mouse doctor. Mickey Mouse doctor. Okay. The second question, whom you are talking to. Whom you are talking to. I'm talking to a child. Someone. I want to speak in a bit of details. I want to speak in a layman language. I want to speak slowly. I don't want to be jumping up and down and talking about things that's very difficult to the patient. Okay. The third question, where you are. Where you are. So who you are, whom you're talking to, where you are. Okay. All right. Now, let's move to something else that will show you how is like the assessment. How do you get assessed in the exam? How do you get assessed in the guys? The rest is the same. The rest is the same. Psychiatry, cardiology, you know. Yeah. Yes, Dr. Suhaib, Disneyland. Disneyland, yeah, brother. Disneyland in Pakistan. Yes, Dr. Suhaib, Disneyland. So let's talk about how do we get assessed in PLAB 2. Okay. How do we get assessed in PLAB 2? That's very important. Okay. Very important. Every station is 12 marks. Every OSCE is 12 marks. 12 marks. Okay. Write down the first 4 marks. First of all, please guys, I need someone to write down as we go along. So every OSCE, how many mark? 12. Every OSCE, every station, every cubicle, 12. Okay. How many minutes? How many minutes in every station? Every station, how many minutes? I have 1.5 minutes. I have 1.5 minutes at the door to read the question. And I have 8 minutes inside. So 1.5 minutes at the door to read the question. And I have 8 minutes inside. Okay. The 1.5 minutes to read the question. The 1.5 minutes to read the question. Briefly, I will tell you briefly. What is the last thing you want to look at before you open the door? You have 1.5 minutes. What is the last thing you want to see and then open the door of the cubicle? The name of the patient. The name of the patient, because you have that day 16 names and you don't want to be confused. So the name of the patient is the last thing. Okay. Come to the 8 minutes. 8 minutes in the cubicle. 8 minutes for the station. Every station you will be assessed in 3 parts. Every station you will be assessed 4 marks, 4 marks, 4 marks. So I will write in the chat box now. Every station, okay, you have 3 domains. 3 domains, okay? 4 marks each. 4 marks each domain. Okay. Now, what is the first domain? What is the first domain? Write down. What is the first thing they assess me on? Okay? Write down, because because you will be shocked. Now you will be shocked. Shocked. I will shock you. I will give you the shock of your life. The first 4 marks, write down. The first 4 marks, write down. Write down. Write down, please. Write down. The first 4 marks, history, examination, investigation. Write down. Write down. History, examination, investigation. Oh my God. Oh my God. The first 4 marks. The first 4 marks, Dr. Muhammad. The first 4 marks, history, examination, investigation. So by the time I reach investigation, I only collected 4 marks out of 12? Yes. Only 4 marks. Yes. Only. I will tell you things. Maybe some of you, maybe they've been studying for PLAB 2, but they don't even know that. History, examination, investigation, yes. Oh my God. What about the second 4 marks? The second 4 marks is telling the patient provisional diagnosis and management plan. Again, write down. What is the second 4 marks? What is the second 4 marks? Telling the patient. No, not only management. Please focus. Not only management. I said telling the patient provisional diagnosis and management plan. Okay. What did I say? Management what? Management what?
Plan.
Okay.
Plan.
I don't say management because in Egypt, we tell our patient, brother, you will take this, brother. You will take this, brother. You will take this, brother. And this, doctor, can I don't ask you question. This is why you're gonna take. Go home. But in UK, it is called management plan. Plan means, brother, I'm thinking we're gonna do that. What do you think? Can you do that? What do you think if we do that, and then if this is didn't achieve this, we're gonna do that? What about that? Do you think start with this? What about this? Would you like to talk about this first or this first? Management plan. Two-way conversation. Two-way conversation. Management plan. Management plan. Dr. Muhammad, بس can you delete the camera or switch off the camera, or because people are saying that yeah, if you don't mind. Yes. So management plan. So management plan and diagnosis. Okay. How many marks left? How many marks left?
4.
4. The last 4 marks. The last 4 marks for communication skills. What is the meaning of communication skills? Communication skills is how you are talking to the patient, the way you are talking to the patient, the way you are involving the patient with you in the station. Not like, brother, you have been eating pizzas and burgers and you have to stop eating pizza and burger because it's not good for your diet. No, brother, you have a condition called such and such. One of the main risk factors is eating unhealthy food. What do you think if we start working on this point? I think if we start working on this point and if we make sure that you eat healthy, it will help you a lot and it will improve your condition a lot. Can you do such thing? Why don't you think about it? And we can discuss this later when you're ready. What do I do now? How am I talking to the patient now? How? It's plan. It's not, I'm not gonna force you into this. That's not by force. It is a management plan. What do you think? Because if the patient refuse, can he refuse? Yes, it's up to him. That's why it's a management plan. So back again. Can someone tell me what is the first 4 marks for, the second 4 marks for, the third 4 marks for? Can someone divide them on the chat box? Chat box.
Yes. Chat box.
Chat box. Write them down. I need someone to write them down. So I make sure that, guys, yes, if someone understands what's happening. So history, examination, investigation, 4. Okay. Then provisional diagnosis management. Then communication skills. Okay. Now, you know the 4 marks. You know the 4 marks communication skills. You know the 4 marks communication skills. Where do you think, again, where do you think you will be able to show your communication skills more? Again, focus. The communication skills, the IPS, the interpersonal skills, where do you think you will be able to show them more? Do you think you will be able to show them more in history? Brother, any chest pain? No. Any shortness of breath? No. Any abdominal pain? No. Any headache? No. Or do you think you will be able to show it in management and provisional diagnosis? Which part would the communication skills show more?
Management plan.
In management and provisional diagnosis. In management and provisional diagnosis. So if I want to split the marks, I will tell you, I can put 1 mark of the communication in the history and 3 marks on management. Do you understand me or not? I hope you get what I'm trying to say. I hope. So for example, history, examination, all 4 marks, no, 5 marks, because 1 mark from communication skills will go there. Management and provisional diagnosis, 8 marks. 7 marks. Guys, do you understand what I'm trying to say?
Yes.
So the next question will come. The next big mistake that people do, and that's why they fail and they don't pass PLAB 2. Out of the 8 minutes, how much should I spend on history and examination?
3 minutes.
No, but I will say it 4. Maximum 4 minutes. 4 minutes. 4 minutes. 4 minutes. 4 minutes. You should be finished by history. 4 minutes. You should start the management. You should start the management at 4 minutes. 4 minutes, Dr. Mo? Yes. But people start the management at when? When do people start the management? At 6 minutes. When do people start? When do they start?
6 minutes.
Last 2 minutes.
7 minutes.
Last 2 minutes. When they hear the bell? 2 minutes remaining. Thank you very much for the information you're giving me, and they change. You know, you need to do 1, 2, 3, 4, 5, D1. No. History, examination will be finished in 4 minutes. 5 maximum. But before the 6-minute bell, you should be starting in management. Guys, by the way, that's not my prediction. This is what I have been told to myself, because I assess people in the OSCE exams, in the final year medical students in Liverpool. I assess them the same criteria as PLAB 2. Their OSCE in the final year is copy and paste of your own OSCE. Same. Also, this is the GMC. Can you see? Can you all see the camera? Yeah. Can you see the camera? Yes. This is the GMC. Yes. Can you see? This is not by Dr. Mo. This is by the GMC. All right. Okay. Look. Yeah. What is the first domain? What is the first domain?
Data gathering.
And what is that? Can you read? What is that first domain?
Taking, physical examination, practical procedures, investigation leading to a diagnosis.
What is the second domain?
Clinical management skills.
What is that?
Formulating a diagnosis, explaining something to the patient, formulating a management plan.
Okay, did you understand anything from what I said?
Yeah. Same.
Yes. So basically, you need to study smart, not hard. Smart, not hard. Yes. Smart, not hard. So when I study, number 1, I will always focus on the question where I am, who I am. FY2, I'm Mickey Mouse doctor. I'm in a GP, I'm in an NE, am I in a hospital, am I in a clinic, okay? And I'm talking to the patient. So all the time, I will be telling the patient, speaking to the patient in a, very simple layman way. And every time when I practice, I will make sure I will focus, I will leave time on management, leave time for management. So I will finish my history by 4 minutes, 5 minutes maximum. If I'm late in history, 5 minutes. 5 minutes if I'm late in history. Okay. How much history should I take in every station? How many differentials should I take in every station? And that's all. It's you know, it's PLAB 2. We have 400 stations in PLAB 2. So every station has relevant history that you must take, and obviously it's just an induction. Okay, so relevant history that I should take. And the 400 station, when I say study smart, not hard, the 400 stations, they should be on maximum 8 structures. Dr. Roba, is she online? I could see she's messaging. Dr. Roba, I saw her messaging. Dr. Roba.
It's me, Vipal.
Are you Dr. Roba in August? Are you Dr. Roba on August group?
Yeah.
Very active. You are very active in the group. Very active. I see your name all the time.
Really? Thank you.
Yes. So, guys, the 400 stations in PLAB 2, they are not 400. They are not 400. What do you mean? What do you mean they are not 400? What do I mean by they are not 400? I mean, they are 8 structures. 8 structures. So, for example, you have 30 stations in pediatric, 30 stations in pediatric, all one structure. You have, for example, 25 stations, 30 stations psychiatric, all one structure. Surgery, one structure. All medicine, one structure. Counseling, one structure. Any scenario, blood results coming, one structure. You understand me? So it is every group of stations, they will follow one pattern. Every group of stations, they will follow one structure. They're not gonna follow, I mean, you will not deal with every station separately. Every station is not separate. So every group of stations are one structure. For example, all psychiatry, one structure. All pediatric, one structure. Counseling, one structure. So that's the way of study smart, not hard. People, when they study, they bring scripts and they keep reading dialogue, and that's it. Every station has its own dialogue. No, every station does not have its own dialogue. Every group of stations has its own structure. And that's why you should always focus on, I will be structured. I will be structured. For example, I will give you just one example. Okay? One example. For example, whenever we talk about tiredness cases, whenever we talk about tiredness cases, whenever we talk about them, I always say, tiredness, what are the causes of tiredness? What are the differentials for tiredness? What are the differentials for tiredness? What are the differentials for tiredness? Causes.
Anemia, pulmonary edema.
Okay. 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 Can you write them down? Can you write them down? Can you write them down? Write down. Write down. A, B, yes. A, B, C, D, E, yes. A, B, C, D, E, F. That will bring A, B, C, D, E, F more. That will bring you into the whole differentials for tiredness. A, anemia and obstructive sleep apnea. A, anemia and apnea. B, TB. C, cancer and the chronic fatigue syndrome. D, diabetes, depression, drugs. When I mean drugs, I mean medication side effect. Diabetes, depression, drugs. Drugs means medication side effect. Okay? Diet. E, endocrine, hypothyroidism. F, fibromyalgia. Mo is my name, mood. So these are the causes of tiredness. So whenever you approach tiredness station, you will have a structure, P1, P2, P3 maftosa, P1 such and such. When you come to the differentials, you have in the differentials A, B, C, D, E, F, Mo, which will bring all tiredness station in one topic. All tiredness station in one page. Okay. For example, causes of, or if a station is coming, weight loss station. Okay, weight loss station. Can you write down the causes again? A, B, C, D, E, F. Again, A, B, C, D, E. Mo. Weight loss. Oh my god, is it the same? It is the same. Yes, it is the same. Yes. Or simple diet 2, diabetes, hypothyroid, hyper, cancer. Yeah. So A, B, C, same weight loss. A, anorexia. A is anorexia and appetite. B, TB, can lead to weight loss. C, cancer. D, diabetes, depression, diet. E, endocrine, hyperthyroidism. Mo, mood, low mood can lead to weight loss. My point is that will go into a structure. That's not just differential. These are just differential, but they will go into a structure. A structure means you have a structure for medicine. When you have a patient who's coming with tiredness, weight loss, headache, I follow a certain pattern, and in this pattern, I put my differentials and I go with the station, with the structure, and that will go with every single system. So my point is, study smart, not hard. Every group of stations will follow one pattern. Who you are, where you are, whom you're talking to. When you study time management means you have 12 marks in every station. 4 for history, for history examination, and procedure investigation, for management and provisional diagnosis, and the last 4 is for IPS. So always make sure you start the management early. Some tricks, and just using the brain a bit, try to just like, and one more thing, if you have 8 minutes, this message for those doctors who go and start reading about details. Some doctors, they go and they read about details, too much details, not needed. Why too much details are not needed, guys? Why too much details in management are not needed? Why? Can you answer me on the chat box? Why too much
Junior doctor
in management are not needed? Why? Number one, because you are an FY2. Number one, because you are an FY2. So your job is superficial. Number two, not only because you are an FY2, number two, because whom you are talking to. You are talking to a patient. There is no examiner. In the station. You are talking to a child. Perfect. Dr. Sana, that's it. Now she knows our language. Yes. You understand? You are talking to a child. Do you think he will be interested in the mechanism of action of things? You think about it. Do you think he will be interested in the mechanism of things and further stuff? He's not. He's not going to be interested. So that's why I'm saying, the less you talk, the more the patient will talk, the more the communication skills will happen. Okay, one more thing. If you want to talk too much, how would you involve the patient? If you want to boom during all the station, the 8 minutes you just want to keep talking, where will be the IPS? Where will be the IPS if you keep talking? Where, guys? Tell me.
Management plan.
No, I'm saying if you keep talking, you have only 8 minutes to take history and examine provisional diagnosis management. So how much do you think you will have time to speak about management? And if you have plenty of stuff, how will the patient talk? Where is the IPS? Where?
Nowhere.
Guys, do you understand what I'm trying to say?
Yes.
because it's very frustrating. It is very frustrating because you guys, I don't know, you just like, you know, very frustrating. Can you read the last phrase? I need one of the doctors to read the last phrase, okay? Can you read this phrase? By the way, this is from the GMC, okay? This is from the GMC. That's not mine. Can you see? Okay. Can you read the last phrase about the interpersonal skills? Can you read, please? Can you read?
How you approach the station, whether you establish a rapport with the
Rapport.
patient,
1
how
second.
you use
Stop. What is the meaning of rapport with the patient?
Build communication skills, IPS.
Yes, guys. No, build rapport means how is this condition affecting your life? What is the impact of this condition in your daily activity? What is that? For example, if the patient is coming with hip pain or hip problem for about 2 months, 2 months he's having hip problem. More important than the medicine at first, hip problem. Can you walk with hip problem?
No.
So the psychosocial impact. How is this hip problem affecting your life? How is it affecting your daily activity? Obviously, the doctors who are in the course and they are watching this session now, they are fed up from this. But I'm talking to other doctors. How is it affecting your daily activity? How is it affecting your, that's rapport. Yeah, carry on. How you approach the station, whether you establish rapport with the patient. Carry on.
how you use open and closed questioning.
Guys, how to use open question. Some doctors recently, I don't know where they get these ideas from, and even they are in my course. Dr. Mo, people have been talking and saying that when we go to the exam and we ask the patient and we tell the patient, tell me more, the patient will be upset. I'm sure you've heard this before, yeah?
Yeah.
No, you've heard. I've heard it myself. People telling me in my course that they're saying, I always tell them use open question. But they say, well, doctor, we will go told the open question will make the patient angry. When we say to him, tell me more, he will say like what? You've heard this before or not?
Yes.
Anyway,
Yes, doctor.
that's the GMC. The GMC saying, oh, how to use open question. Okay, carry on.
Involving the patient and demonstrating your professionalism and understanding of ethical principles.
Guys, tell me, guys, how would you do all of this? That's, by the way, that's only communication skills. That's the IPS. If you want to talk too much, would you have time for this?
No.
No, seriously. I don't want you to just say no to make me happy. If you want to talk too much, would you have time for rapport involving the patient, demonstrating this, would you have time for this?
Oh, I don't think so.
You're not going to have time for this. So the GMC said to you, guys, 1/3 of the mark is going for communication skills. 1/3. 1/3 is for involving the patient, how you talk to the patient, building rapport with the 1/3. 1/3. Okay. I will tell you something else, okay? Can you write down? Can you write down 444 on the chat box? Write it down. 444. Okay? 444. What are these 444? 4 is history and examination and stuff. 4 management and 4 communication skills. Okay? I will give you another point to prove my point. Okay? You will never, listen carefully, you will never find someone who scored 1 out of 4 in communication and passed the station. Again, can you repeat this again? Can you repeat this again? What did I say? What did I say? What did I say?
Never gonna find total 4 on first station.
You will never find someone who scored 1 out of 4 in communication and passed the station. What do you mean by that? If your communication skills are bad, you're gonna fail. But in the marking sheet, you will see doctor who scored 1 in management and passed. What do you mean, Dr. Mo? I mean 3 history, 1 management, 3 IPS, 7. And the passing score in the stations, 5.5, 5.76 maximum. That's the passing scores in the stations. So can you score 1 out of 4 in management and pass? Yes.
Yes.
Which means you can see a result 313, 3 history, 1 management, 3 IPS, but you will never see 133. You will never see 1 IPS, 3 management, 3 history. Never. Wallah, I will give you 1,000 pounds. 1,000 pounds if you get me a result, 1 communication skills and pass the station. 1 communication and pass the station. And 1,000 pounds, plenty of doctors, 1 management, 1 in management, and they pass. Which means if the examiner doesn't think that you have good communication, you fail. Khalas, done, finished. But you can have good communication, but management was not perfect, was not great, but he will pass you. Because, guys, communication skills will reflect in the whole station. Communication skills will reflect in the whole station. Wallahi, the performance. You look nice. When you have communication, you're involving the patient, things back and forth, and you taking the patient opinion, putting the plan, you know, you look nice. That's why the examiner, sometimes they don't even feel that your management is not good. You are so good in involving the patient and in moving on with the consultation to the level that sometimes we don't even notice that you did not talk properly about management. So I told you 1,000 pounds, Egyptian pound, Dr. Adam. 1,000 Egyptian pound. If you find a result, 1 communication skills and pass. And at the same time, plenty of people. 1 management and pass. So 1 thing, if it's bad, you will fail. What? 1 thing, if it's bad, you failed. I mean, you failed. Communication skills. If it's bad, you failed. Yes, Dr. Sarah, she said to cesarean section. 1 thing, if you're not good at cesarean section, CS, you fail. Communication skills, okay? So, yeah. So that's, I showed you the sheet about how they divide the marks and the 3 domains and the content of every domain. And I will tell you something that you will be shocked. You will be shocked. You will be shocked. 99.9%. 99.9%. By the way, you are all smart. You are all smart. You are all smart. You are all smart. According to the sheet that I showed you, does it make sense to start the management at 6 minutes?
No.
No, seriously. Does it make sense?
No. It doesn't.
Let's talk. I want you to see this, to look at this. Okay? These are the domains, okay? Look, this is the domain, data gathering. Can you see, guys?
Yes.
Data gathering, assessment skill, 4 marks. How many marks? 4. Second domain is the management. How many marks? 4.
4 marks.
Third domain is IPS. How many marks? 4.
4
okay.
marks.
I will speak to you with the worst case scenario. What do you mean, Dr. Mo, worst case scenario? No. Worst case scenario means the communication skills, I will put 2 marks here and 2 marks there. Do you understand me?
Okay.
I will divide it fairly. Maybe when I said 1 and 3, maybe I'm being unfair. Maybe I'm trying to trick people. No, I'm going to divide it fairly. Fairly means that the 4 marks communication skills, I will put 2 in history and 2 in management. Clear?
Yeah.
So how many marks the history ended to be?
6.
How many marks management ended to be?
6.
So even when I split the management, the IPS fairly, and how many minutes I have for the station?
8 minutes.
So how much time should I spend here and there?
4 minutes.
Equal marks. 4 and 4.
4 minutes here, 4 minutes there. Do you agree with me?
Yes.
Did you understand what I did now?
Yes.
Yes.
Okay. wallahi, every single person, they advise you guys to start the management at 6 minutes. People advise to start the management at 6 minutes. It doesn't make any sense. Doesn't make any sense. The GMC themselves, okay, they put criteria. They said this is what we mark against. Can you see?
Yes.
So it's up to you at the end of the day how much you will spend on, and how would you one of the doctors said, how do we do the timing? Too much practice, you will feel the time. When you practice a lot, you will feel it. You will feel it. Yeah, when you practice a lot, you will feel it. You understand? When you practice a lot, you're gonna feel the time. Okay, guys, thank you very much. I hope that made sense.
Thank you, sir.
That cleared some of the doubts, and I hope that this has cleared some of the misunderstanding about what and when, how much history, 60 minutes, how minutes remaining, should I start management here? And by the way, when I said to you who you are and where you are, and some of you may think that, for example, it was nonsense, the session, but the sessions was basically the principle of PLAB 2. Principles, things that you're not gonna hear. You will never hear about this, who you are and where you are and what is your duty and what should you do. And obviously PLAB 2 is a big thing. So I mean, I tried to cover as much as I can important stuff in the 1.5 hours, because I'm not going to discuss everything about PLAB 2 in the 1.5 hours. So I just tried my best to bring the most important points that I know you will not hear it easily and it will not cross your mind. Okay, practice is the key. If you read everything and you don't practice, 100% you will fail. And if you practice and you read less, or if you practice and you don't read much, 100% you will pass. So practice is the key. Practice with your friends. Simulating is the key. All right.